Welcome to Pinoy Medical Coder. We'll be discussing ICD10CM official coding guidelines for vaping-related disorders. Before we begin, don't forget to like our Facebook page and like and subscribe to our YouTube channel. This topic covers coding encounters related to e-cigarette or vaping product use. Post date October 17, 2019. The purpose of this video is to provide official diagnosis coding guidance for healthcare encounters related to the 2019 healthcare encounters and deaths related to e-cigarette, or vaping, product use associated lung injury. This guideline is consistent with current clinical knowledge about e-cigarette, or vaping, related disorders. As necessary, this guideline will be updated as new clinical information becomes available. The clinical scenarios described below are not exhaustive and may not represent all possible reasons for healthcare encounters that may be related to e-cigarette, or vaping, product use. Proposals for new codes that are intended to address additional detail regarding use of e-cigarette, or vaping, products will be presented at the March 2020 ICD-10 Coordination and Maintenance Committee meeting. This guideline is intended to be used in conjunction with current ICD-10CM classification and the ICD-10CM official guidelines for coding and reporting, effective October 1, 2019. The ICD-10CM codes provided in the clinical scenarios below are intended to provide e-cigarette, or vaping, product use coding guideline only. Other codes for conditions unrelated to e-cigarette, or vaping products may be required to fully code these scenarios in accordance with the ICD-10CM official guidelines for coding and reporting. A hyphen is used at the end of a code to indicate that additional characters are required. General guidelines. Lung-related complications. For patients documented with electronic cigarette, e-cigarette, or vaping, product use associated lung injury, assign the code for the specific condition, such as J68.0, bronchitis and pneumonitis due to chemicals, gases, fumes and vapors, includes chemical pneumonitis. J69.1, pneumonitis due to inhalation of oils and essences, includes lipoid pneumonia. J80, acute respiratory distress syndrome. J82, pulmonary eosinophilia, not elsewhere classified. J84.114, acute interstitial pneumonitis. J84.89, other specified interstitial pulmonary disease. For patients with acute lung injury but without further documentation identifying a specific condition, like pneumonitis or bronchitis, assign code J68.9, unspecified respiratory condition due to chemicals, gases, fumes, and vapors. Poisoning and toxicity. Acute nicotine exposure can be toxic. Children and adults have been poisoned by swallowing, breathing, or absorbing e-cigarette liquid through their skin or eyes. For these patients, assign code T65.291, toxic effect of other nicotine and tobacco, accidental, or unintentional, includes toxic effect of other tobacco and nicotine not otherwise specified. For a patient with acute tetrahydrocannabinol, THC, toxicity, assign code T40.7X1, poisoning by cannabis, or derivatives, accidental, unintentional, substance use, abuse, and dependence. For patients with documented substance use, abuse, and dependence, additional codes identifying the substance used should be assigned. When the provider documentation refers to use, abuse and dependence of the same substance, in example, nicotine, cannabis, etc., only one code should be assigned to identify the pattern of use based on the following hierarchy. If both use and abuse are documented, assign only the code for abuse. If both abuse and dependence are documented, assign only the code for dependence. If use, abuse and dependence are all documented, assign only the code for dependence. If both use and dependence are documented, assign only the code for dependence. Assign as many codes as appropriate. Examples: Cannabis-related disorders, F12. Nicotine-related disorders, F17. Specifically, for vaping of nicotine, assign code F17.29, nicotine dependence, other tobacco products. Electronic nicotine delivery systems, or ENDS, are non-combustible tobacco products. Signs and symptoms. For patients presenting with any signs and symptoms, such as fever, etc., and where a definitive diagnosis has not been established, assign the appropriate code for each of the presenting signs and symptoms such as M79.10, myalgia, unspecified site. RO6.00, dyspnea, unspecified. RO6.02, shortness of breath. RO6.2, wheezing. RO6.82, tachypnea, not elsewhere classified. RO7.9, chest pain, unspecified. RO9.02, hypoxemia. RO9.89, other specified symptoms and signs involving the circulatory and respiratory systems, includes chest congestion. R10.84, generalized abdominal pain. R10.9, unspecified abdominal pain. R11.10, vomiting, unspecified. R11.11, vomiting without nausea. R11.2, nausea with vomiting, unspecified. R19.7, diarrhea, unspecified. R50, fever of other and unknown origin. R53.83, other fatigue. R61, generalized hyperhidrosis, or night sweats. R63.4, abnormal weight loss. R68.83, chills, without fever. This coding guideline has been approved by the 4 organizations that make up the cooperating parties: the National Center for Health Statistics, the American Health Information Management Association, the American Hospital Association, and the Centers for Medicare and Medicaid Services. Please check the reference at the CDC website. Thank you for watching.